it's very important to understand the 2013 ACC AHA guidelines as they were written. And I think there's been a lot of misinterpretation. Lipids should be measured. They should be measured anywhere from 3 to 12 months after the intervention to assure compliance and ultimately the level of LDL cholesterol achieved. What the guidelines did not have evidence to support that targeting LDL cholesterol levels at 160, 130, 100, or 70 was evidence-based. However, it did not say that setting LDL or non-HDL cholesterol goals isn't appropriate. In fact, I was on the guideline committee and I set goals for my patients. It's not wrong, it just wasn't evidence-based sufficiently based on the clinical trials that were carried out using statins.
We explicitly recommended that people should do follow-up lipid testing after putting someone on a statin. I know that it's out there to say that we said fire and forget, just put them on a statin and you never have to measure again. In fact, we gave a 1A recommendation that people should follow lipid levels after starting a statin therapy every 3 to 12 months and as indicated clinically because of dose changes or patient symptoms.
The reason the lipid panel is so valuable and the reason that it received a Class 1 recommendation, it should be done, is that it helps us understand whether patients are adhering to medications. It helps us understand whether they're getting the benefit that they should get from intensive statin therapy or moderate therapy. So that's why I do a lipid panel in my patients before starting statins and regularly afterwards. And I think that the practicing community, when using this recommendation, will see that it's very important to their practice.
It's really our best biomarker of adherence. So if the patient is following the lifestyle that you've recommended and is taking their statin, we would expect to see a nice reduction in their LDL. If it's not there, I think it should prompt the clinician to probe a little bit deeper, to ask questions like, well, in the last 30 days, how many times did you miss your statin medication? And you'll often get a different answer than if you just say, are you taking your statin? So I think that biomarker of adherence concept is critically important, and that's part of why we said you really need to continue monitoring these things, as was done in all the clinical trials, of course.
It's really important for us to understand how the practicing community responds to recommendations in the guidelines. And I would hope that they have found the switch comfortable to using a dose-based statin therapy coupled with the measurement of the lipid profile. I think it's time for us to get some feedback on that question. I do think a good study on what's happening would aid us to understand how much our guidelines and what they're doing, how they have influenced care.